Welcome to these screencasts named Arthritis Below the Belt. They have been produced as a collaboration between Arthritis SA and the Continence Foundation of Australia. This first screencast is just a brief introduction to explain how living with arthritis and the problems of incontinence can be linked. So what are the links between arthritis and continence? There are 5 main links. First is loss of mobility, which may increase the time it takes for an individual with arthritis to get to the toilet facilities. Secondly, arthritic joints may be stiff, lose range of movement and lose strength, creating difficulties getting on and off toilet seats or with intimate care. Thirdly, unfortunately, arthritis becomes more common with aging, and we also see changes in the efficiency of our bladder and bowel system as we age. Fourthly, impact of medications on bladder and bowel function. For example, people with arthritis may be taking pain medications that may include opioids or codeine, and these will impact on our bladder and bowel. Lastly, autoimmune forms of arthritis and connective tissue disorders can directly affect on the way that our gastrointestinal system works and the way that our bladder and bowel function. So this will be something we cover very briefly. Limited mobility can result in people with arthritis simply not reaching the toilet in time. Some of the measures people can take to avoid accidents can actually make their incontinence worse. For example, individuals often go to the toilet before they need to in order to avoid any accidents later. While this may work in the short term, it can lead to the bladder losing its volume capacity over time, meaning that you have to empty it more frequently and increasingly get to the toilet in time. Some people also try to reduce their fluid intake in the hope that this will reduce the number of trips they need during the day. While this appears logical, it actually causes the opposite effect. Insufficient fluid intake causes the urine to become very concentrated, and that can irritate the bladder and mean that it wants to empty its contents more often. Either going without the urge to go or restricting fluid can actually result in worsening frequency and urge incontinence. If your shoulders, hips and knees are stiff or painful, it can be difficult to get down to the toilet, up again, or to reach to clean yourself. There's a wide range of equipment that can help, including grab rails, toilet seats, frames around the toilet, bottom wipers, or even a bidet which automatically washes and dries you. Stiffness, particularly in the hands and wrists, can make removing underwear and outer clothing difficult. We would encourage you to seek assessment and advice from an occupational therapist, because there is plenty of equipment that exists to give you dignity and independence, making your tasks easier, more hygienic and safer. There are many different ways in which autoimmune arthritis can affect the bladder, the bowel, and in fact the functioning of the whole digestive tract. For example, a painful bladder or interstitial cystitis is actually an inflammatory disorder and often mimics a bladder infection and is seen in connection with things such as Sjogren's and rheumatoid arthritis. We are not able to go into details today, but we just want to raise the awareness that if you have an autoimmune or connective tissue disorder, that bladder and bowel problems may well be related, and the first place to go is to talk to your rheumatologist. They may suggest a referral through to a dietitian in order they can look at how food and diet can help reduce your risk of difficulty and symptoms. Problems with bowel function is nothing to be ashamed of, although we do recognise there is stigma around this area. Up to 15% of individuals have some bowel problems by their 80s. Dehydration, in terms of not having enough fluids, can make things worse as it creates constipation. People with arthritis frequently develop constipation, either because they are unable to be as active as they used to be, because they're limiting their fluid intake to manage bladder problems, or because they're taking some pain-related medications such as codeine, which can further add to constipation. An overfull bowel actually restricts the bladder's volume and capacity to hold urine, so being constipated can affect your bladder function. In addition, straining on the toilet due to constipation can stretch and weaken the pelvic floor. If you have a change in your bowel habits, the first place to go is to speak to your GP. There are many different changes that occur with arthritis and that occur as we age. The message that we hope to say today is seek help early. Don't ignore any problems with your bladder or bowel. Get advice from the experts. This may be your GP, a continence nurse, specialist physiotherapist, urologist, or your rheumatologist. There is plenty of support, such as from the Continence Foundation, the Independent Living Centre, and us here at Arthritis SA. And remember, you are not alone. Tackling these difficult issues can be empowering and can really transform your ability to live life with the quality that you want. We hope you have enjoyed this first brief screencast for Arthritis Below the Belt. There are more to view with much more information, so stay tuned and spread the word to others who may wish to know about this topic.